the United States has the worst maternal mortality rate. This is especially true for black women, that according to the CDC, who says 2 in 3 of the deaths are preventable. In this installment of our Be Well series, we follow a mother through her pregnancy journey as experts discuss challenges and solutions for this public health crisis.
My name is Naneka Mosley, and I am 38 weeks pregnant. My twin girls are 7, and my son will be 4 next month. This was kind of something that we didn't plan for and try for, so it truly was God's plan. And so now I'm almost at the finish lines.
My name is Latham Thomas, founder of Mama Glow. Motherhood is so amazing.
My name is Dr. Rachel Hardiman. I truly believe that mothers are the backbone of our society.
I feel I've been very blessed, especially in light of all that you see in the news going on and seeing so many black women deal with so many unfortunate experiences.
We don't always have healthcare systems that are equitable and high quality and ready and willing to serve black mothers.
The thought of going to the hospital in about a week and a half or so, it's more on my mind about, like, what if this goes wrong? What if that goes wrong?
Black women will state that, they experience things like neglect, dismissiveness, tone policing, microaggressions.
There are a couple of simple reasons why this exists, and the biggest one is racism. I'm Dr. Corey Hebert, Chief Medical Correspondent for BNC.
Some of the work I'm doing is around building out anti-racism training for perinatal care providers.
Really important to have a doctor or provider that you trust. If it's a doctor, if it's a midwife, having a doula is like an added bonus.
When a black family, a black infant is cared for by a black physician, they have better outcomes.
My first pregnancy with the girls, I did have a African-American doctor.
We need to be supporting efforts to build up a workforce that can provide care for the communities that need it.
You must be informed. When you are about to have a baby, you need to read as much as you can.
I did talk to my provider ahead of time just to let them know my reservations, and they assured me that I would be fine, and I absolutely was. I felt the whole experience was great.
Happy birthday, dear Asia.
The kids love the baby. She's a very good baby. I want black women especially to be able to look forward to a great birthing process, a great labor and delivery, and not have to have that as a concern or worry.
According to the CDC, pregnancy-related deaths for college-educated black women are about 5 times higher than white women with similar education. You'll want to watch more of our Be Well series. Just go to bnc.tv, click on health. It's just, again, racism marches through everything. Why do you always got to talk about race?
Yeah.
Why does it have to always be present, front and center? We're not talking about people who don't know how to take care of themselves. We're talking about something plain and simple. Racism within the healthcare industry, because of course race permeates all aspects of society. It is what America's built on. And if you have black women who are educated and white women who are educated, why would black women be dying at 5 times the rate? Unless you're putting it on them and saying we don't know how to take care of our babies, we don't care about taking care of our babies, which would be ridiculous. Some would try it. I just, gotta wake up. Gotta wake up.
Yeah. I don't know why they would even ask why we got to talk about racism. Why does it still exist? It's the big question. Here we are in 2021, and we still deal with the same issues that we dealt with many, many years before. When we're talking about the medical industry, where they have to take an oath. I mean, I don't even understand why someone will want to become a doctor, a healthcare physician, or teacher. Anybody that when you have to interact or do something that involves black people outside of your race, and you have to be there for that person or those people that you have to take care of in some sort of regard. Why would you even get into that profession if you have those thoughts and that process? When you look at the rates, 2 or 3 deaths preventable, 3 times higher chance of death for a black woman than a white woman, and you said it's even higher for people who have a college education. It's stunning, but it's the same thing, Sharon, not just for pregnancies, the mortality rate. We're talking about for cancer. We're talking about for every health issue there always seems to be a disproportionate number of black people who suffer far worse than our white counterparts. That's the why question that people should be asking, and now why should we be talking about racism? Because that exists and those numbers exist. So that's the why. And this is the reason why we'll continue to talk about it.
And remember what we learned though. It's not just, it's the nuance that is worse than the overt racism, right? It's people who don't even realize that they're not listening. They don't even realize that they're predisposed to think a black woman who's going through pain can either A, handle the pain better, or B, is running a con because maybe she wants some more pain meds. This is society. This is America. Look at your life. And this is what we're predisposed to. Even some black consumers of this racial injustice, because it's just what they grew up believing. So we have so much to unpack. I saw something on social media over the weekend where they said, boy, these people who are out marching and protesting, they think they're protesting racist systems in America. And that's what many of us think we're doing. And they said, but they're not. America is the system. That's what America's built on. And what they're really doing is protesting America. In a sense, it's what they're doing. Right. America's founded on these principles and these systems of discourse and racism. And yes, black babies, black mothers are dying. And there's another example.
Oh, you can't do that. You can't do that, Sharon. That's good. You talking about critical race theories now. You can't. No. Yeah. I don't know what state you live in. Georgia. Is that allowed? I don't even know if you can. Is Georgia?
Ain't allowed here. Georgia still has books.
Yeah,
Georgia still has books in classrooms talking about how slavery wasn't so bad and how the slaves sang in the fields and passed the time, and it was great. It was kind of great. The hymns and the things
we live in a society.
This was in the textbooks. Still.
It sounds like Donald Sterling when he said with the Clippers, like, what are they complaining about? I clothe them, right. I feed them, And then we also live in a society where even our Jewish brothers and sisters, there was, I can't remember what state it was, where somebody said, we should show the other side of what happened with the Holocaust. The other side? Really? That's the type of mindset that a lot of people have out there when it comes to race in this country, because it's just ignorant. It is just stupid. But we got to change. We got to get more OBGYNs and more black doctors out there as well, because there is a difference. I'll tell you that. Had 2 children, one white OBGYN. She was nice. She was fine. He was nice, I should say. And then my second child, black OBGYN. Still remember her name, Dr. Roach. Wonderful. Wife had some health issues, some process. We was concerned at one time. Her love, her care, just her affection, her emotions. You felt connected to this woman because she understood what this black woman was going through. I'm not saying that a white woman would not have, but it was a different type of connection when it came to my wife at the time and what she was going through. And it was, you felt it and you saw it. And you know what I'm talking about. You feel it. So we got to get more of more black people in the medical profession to help change that.
Go sing a hymn about it. Go tell it on the mountain.
Sweet chariot, coming for to carry me home.
It's not us. Y'all can do it. It ain't us. It's not him. It's not me.
That's what they want us to do.
We're just a reflection
of
you.
But we shall overcome.
That's all it is.
We shall overcome.
And
we shall be right back right after this.